A well-earned rest, as they say. And we're talking about debt at the moment, personal debt. Bailiffs resuming operations in England and Wales. They're being told to keep their voices down to protect against coronavirus transmission. They're also not going to be generally going into homes and seizing goods. But debt charities have warned that there's going to be a surge of cases and there are going to be real financial and health risks. So that's what we're talking about. I'm asking for your views and experiences of this. And let's bring in now Conor D'Arcy, who's Head of Research and Policy at the Money and Mental Health Policy Institute. Hello, Conor.
Hi, Clive.
I really wanted to talk to you because there's a huge link, isn't there, between money worries and mental health problems.
There is, and it unfortunately can end up being a vicious cycle. So, you know, if you're struggling with your finances, as we've been talking about, that can really take a toll on people's mental health. It can mean that you're not sleeping well, you're worried all the time, and that can build up into what is basically a mental health problem. I think the other side of it that people might be less aware of is that, you know, once you've got a mental health problem, that can make it harder to actually get the support and help that you need. So, you know, while it can seem straightforward to say, you know, if you pick up the phone to the person that you owe money to, you can resolve it. For, you know, common symptoms like difficulties with problem solving, difficulties communicating, phobias around using the phone or using the internet, can all make it really hard to actually get that support. So it just ends up in this unfortunate cycle.
And it doesn't actually have to be huge amounts of money. I was talking to a caller yesterday who had, because of COVID, hadn't been able to get out, had failed to pay her bill a couple of times. I think it was a phone bill, something like that. It was a fairly minor default. But then she started getting letters saying, right, we've reported you to credit rating agencies. And she said it was affecting her health, that she was so worried about this bill that she'd paid, but paid it late, and worried about credit rating and what it was going to do. It was, I mean, even something as small as that can really weigh on you.
Absolutely. And, you know, we've seen some improvements on this, and, you know, there's been more guidance from the Financial Conduct Authority and others that are regulating the likes of banks and these other sectors. But the communications point is so important. If you get a letter through the door with, you know, large, bold, capital letters saying that you owe money, the certain consequences that can happen, but without knowing actually there is lots of support out there for you, actually we're at a very early stage, it can lead to people, you know, disengaging, and again, that mental health worry can just put people off solving a problem that, as you said, can often be quite small. You could arrange payback that is of a smaller amount every month that you can afford. So there are often routes out there, but I think the communications point is so important, and one where a lot of firms could do a lot better.
Is it, if you've got a problem with a lender, for example, should you actually mention that you do have a mental health problem?
I think this is one that we always recommend. And again, it can be really tough. So, you know, while we reckon that about 1 in 4 people in any given year will have basically a mental health problem, often we don't know that because, again, we're snowed under with debt or we're stressed about life in general. We're not aware. We haven't got a diagnosis. So for those people, it can be difficult to tell an advisor or someone working for a phone company or an electricity company. But I think, you know, there's also definitely we often encourage firms to ask about that and make it a good environment and a safe environment for people to disclose that they do actually have a mental health problem, because there is lots and lots of guidance out there for firms about what they should do with vulnerable customers and how they should be treated. And, you know, that should apply to bailiffs too in terms of how they respond to that. The government's issued some guidance around that recently, which again should help. But again, I think while it's great if people can do that, if they feel comfortable doing that, there's still a really big onus on firms to make sure that everyone is treated fairly and that, you know, you do get your communications right, that it isn't too harsh, that people are given, especially, you know, given we're going through a massive global pandemic, that this isn't all their fault, and offering people support and ways out of this is what they should be thinking of first.
What advice would you have for people maybe who are listening now and are already despairing at their financial situation?
I think, as Joe from Citizens Advice was saying earlier, just people's circumstances will really differ, but there is always support out there. So I think if you're struggling with your finances, Citizens Advice are a great place to contact. Step Change, National Debt Line, and they have various different ways that you can contact them. Sometimes online, sometimes over the phone. Because again, when we're stressed, sometimes picking up the phone can just seem so daunting. If you're struggling with your mental health, obviously if it's more of an emergency situation, Samaritans are out there. But there's other organisations like Mind or Rethink that can offer support and tell you where to go to basically help you to find a way out of your situation.
So do you think we are heading for big problems in the next few months?
I think from what we've seen already, some of the research we've done has found some worrying signs where roughly around 2 in 5 people with mental health problems say they've had a drop in their income since the pandemic, and about 1 in 3 of those have already had to take drastic steps like cutting back on essentials, heating or eating. So there's definitely already some concern out there for how people are managing. Looking ahead, I think the government support, as you were mentioning earlier, there's been lots out there, and people have been given payment holidays. The furlough scheme has offered much needed support, but I think how all those schemes progress, what kind of conditions are out there in the broader economy are going to be really important. But going through it, I think it is really important how that mental health element is kept in mind, that there is a support offer that is out there from government and from firms to make sure that when support is available, that it's actually accessible to people who have mental health problems, that they're supported to find out and make the most of it.
Conor, thanks very much. Conor D'Arcy there from the Money and Mental Health Policy Institute.